Thank you so much for having me, especially Uncle Bertha. He kept pushing me and asking me to join. And then I felt slightly inadequate when I see all these fantastic, inspirational women here. But then I thought, hey, why not? So when I actually sat down to put down to paper what I actually wanted to say today, and I actually had to ask myself, am I actually empowered? And what does it mean to me? And then again, what does it mean to you as youth leaders? You see, because I think I've been fairly privileged to have had opportunities afforded to me and to do things that would, I suppose, be considered empowered. One of the reasons also is because I think we are living in a time where a lot of these things are considered normal, as opposed to, say, 30, 40 years ago, where we've had so many trailblazing women break those barriers down for us. So in terms of my experience, it's fairly straightforward. I'm still in the middle of my journey, so I've still got quite a way to go. So I graduated abroad. I came back, did the exam, and like Sasha said, I've done a bit of a trip around the island. So I started off in Kurunegala, where I did my internship. And then I went to Jaffna, where I worked in psychiatry, which was a completely different field for me. And after being there, I came back to Colombo, where I worked in emergency. So again, a huge change. And then after that, I went down south to Gaul, and now I'm back in Colombo. So I think I've had a fantastic opportunity to experience different parts of the island and different areas of my profession. But throughout it all, my one goal, what I really wanted to do was surgery, right? And unfortunately, it's still considered something of a man's area in this day and age. And it's not, especially with regard to Sri Lanka, South Asia, and even in the West, the number of women in surgery is far, far less proportionately. I think even in the UK, you would have less than 30%, despite the fact that there are more females actually graduating out of medical school. So, and it's funny though, because being still to this day, when people ask me, oh, what do you do? What are you specializing in? And I'm still training. And I say surgery. And a lot of them will still ask me, oh, why surgery? You're a woman. Right? And funnily enough, a lot of it comes from women itself. And even to an extent where even in my workplace, like I've had women doctors asking me, why would you want to be a female surgeon? Because it's considered a man's area. I think the most simplest explanation for me was that it's what I like. I like doing it, and it's what excites me. It's what makes me want to get up in the morning, despite the early hours, the long hours, and go to work, right? And that's simply it in terms of empowerment for me. Like, it's the ability to choose what you want to do, regardless of whether it's considered a man's area or a woman's area. All that is so that I think is what made me realize that this is what I want to do. And this is what I hope that this choice is available to all of you, especially as youth, as part of your Unity Mission Trust, and as youth leaders. I hope that this opportunity, this choice is available to you. And I think as people involved in this community, I think it is also part of our duty to make sure that we can propagate this around people. Right? So initially, so basically, it didn't start very easily for me. Right? Despite the fact that I had this goal of wanting to do surgery, I really had to push myself out of my comfort zone. Because when you start working in a particular area, you get very comfortable and it's a lot easier, right? And as much as I enjoyed my stints around the island, I knew that this is not what I wanted to do for the rest of my life. I actually wanted to pursue my goal in surgery. But it took a long time. I did this exam multiple times, right? And I think we have a little bit of a, we don't want to share how many times we failed. I mean, or how many times we had to attempt to do things, right? But I think it's important to know that, you know, it's not always like things fall into place, right? You actually have to push yourself sometimes. And it takes a long time. I tried many times. And coincidentally, the one time when I actually did pass and I made it through into the surgical training program was after I had my child, 9 months post childbirth, which was completely unexpected. So it's just a matter of pushing through, and even still to this day, especially when you're surrounded by, in a field where it's basically mostly dominated by males. And in my batch of trainees, there were just 2 females, me and another girl. It's still difficult because you still tend to judge yourself, right? And then you feel that people around you are judging you, and you tend to question your ability. Am I able to do this? Is this what I should be doing? Am I actually pretending to myself that this is, I'm just trying to do something that is actually a man's territory? But when you have those feelings, and I think, like somebody pointed out to me, that as women we tend to internalize these societal constraints ourselves, which is not right. You have all opportunities. So even though you hear it from outside and sometimes unconsciously you might bring it into yourself, remember, regardless, if this is what you want to do, push for it, go for it. Doesn't matter how long it takes, you'll get there. If this is what you really want to do, you have a passion, focus on it and work for it, right? I'm still in the middle of my training. I have a long way to go, right? So I can't exactly tell you where I will lead and whether I've actually made it, and I'm hoping that at some point I will. But the idea is that you get yourself to a point where you're able to do some good with the training that you receive, the skills that you acquire. And I feel that end of the day, it's something that we should use for the betterment of all women. Because end of the day, we don't want a certain sector of people to be empowered, just the people who are able. We want everybody. We don't want to leave anybody behind in this journey. So I think that's important, and especially you as youth leaders in your various communities coming from different areas. I think it's important that you work to this together and that you don't leave people behind. Remember, when people question you, why are you doing things that are not traditionally seen as female, a lot of the time, don't take it personally, which is what I've learned to do. I realize that a lot of the time they're saying it because it's something totally new to them. It's alien to them. It's against their cultural norms, traditional norms. So just understand that and use the voice that you have to explain it to them, so that they know that you're not just trying to do things for the sake of it, just to shake things up, right? It's because you actually passionately believe in what you want to do. One thing that Uncle Bertel, they wanted me to touch on was basically, as a medical professional, being healthy as a female. Like, most of you are young, in your prime, and I think we take it as a default when we're young that health is just handed to us. It's not something that you really have to work for. And most often than not, you will generally not have any health problems. The problem starts is in a couple of years down the line, where then, little things tend to crop up. And as females, we have this rather unhealthy habit of, putting up with more, like, oh no, I can take it, I can push myself more, that's okay, But that's not right. Remember, make it a priority now if you can, to cultivate little habits, right? You don't have to go all the way. It's just choosing healthier things, right? Basically, in your food, you don't have to be perfect every time. We all fall off the wagon. I mean, I still have bad days, good days. It doesn't matter. But just remember that you don't have to beat yourself up about it, right? So aim for something like an 80-20% rule, right? 80% of the time, choose wisely, choose healthier choices. 20% of the time, you're free to let yourself go. But keep yourself well and healthy. Remember, activity is important, right? And I know it's not always easy to do. You might not always have access to things around you. You might not always have access to gyms, and you don't need all of that. You can do simple things like go for a walk, take the stairs. It's little things, right? So, but it's just the small little habits that you accumulate and things that are sustainable in the long run. That's what will make the difference, right? And especially ahead of time, like if having a family is part of your plan, if that's what you want to do, being active, being healthy, investing in that now will pay off dividends much later. So think about it. It's not a big thing, but it's little things that you do now that will make a difference later on. And another thing, I mean, we are all, most of you are in your youth, right? But remember, as women, a lot of people who support us in our journeys, in our professional or personal lives, will be women. A lot of time it will be our mothers, our aunts, our sisters, right? And unfortunately, a common thing that we see in our clinics when we have people coming in for problems, especially with regard to women, is that we see them present with the problem extremely late. And in the case, if it's in a case of malignancy or a cancer, we have people coming with advanced breast cancers, which easily could have been treated and cured had they come in at the very initial stage, right? So as youth leaders, I think you have a little bit of a responsibility with your family members, your communities. Get your mothers, your sisters, even your grandmothers, aunts, push them to be tested, to screen themselves for breast cancers, for colorectal cancers. We have national screening programs now, and a lot of this information is available at your local hospital. It's just that we don't think that is there, but if you ask for help, it is there. But do not get into this mindset that, oh no, we must bear it out for the sake of our families, we must ignore it. Do not ignore, even if you are young, if you have complaints, do not push it down. Do not think, no, I will bear this pain, because that's not how you get ahead. And if you really want to make a difference, you need to be healthy yourself. So remember that is an investment in yourself, right? And in speaking of health, it's not just physical health that is important, right? Remember, we have to think about mental health as well, right? And unfortunately, despite a lot of the awareness programs that we've had going around, mental health still tends to be stigmatized. And it's not always in rural communities, it's actually still in educated communities in Sri Lanka itself, right? There is no thing that you have to bear up, whatever feelings that you have. If you are feeling low, or if you are having trouble coping, it is not a sign of weakness that you have to seek help for mental health issues, right? It's perfectly normal. Everybody else goes through it, right? So, and there is help available throughout, right? You just have to reach for the various NGOs, that your local hospitals will always have help. Remember, it's not being strong by ignoring mental health, right? And look out for people around you. A lot of people may be suffering in silence, right? Your friends, your family members. So keep an eye out, especially the women, because as I said before, we have a bad habit of tending to internalize things and hoping it will go away when it doesn't, right? So think about that as community leaders and what difference you can make. And I hope this would be of use to perhaps some of you considering a career in medicine or otherwise. Thank you for taking your time to listen to me, and thank you so much for the opportunity. Thank you, Sasha.